I think it's been beneficial throughout the continuum. If you're talking about patient or if you're talking about provider or financial, it's hit all of them.
The ways that my life has improved with TrueSee are many.
In 20 years of wound care, I've never seen pictures of this quality before. It's amazing.
That's why TrueSee became the standard of care for us, because we saw the benefit.
TrueSee is creating a standard for an industry that currently has none. What if a clinician used instruments that were not calibrated? Lack of photographic standards can lead to inconclusive and erroneous data. Physicians are liable for incorrect and missed diagnosis.
Anybody can take a picture, and it may look different on my camera versus your camera. You know, everyone has a picture on their cell phone now, and they can be altered and changed.
Looking at one photograph can be deceiving, but when you look at a group of the pictures, the differences become obvious. Notice how each skin tone looks different. This one is yellow, this one is green, this one's too bright and doesn't have much detail. And that indicates that everything in the photograph is also inaccurate. The top left photo appears to be normal, but how do you accurately measure this? And when it is the same subject like this lesion, photographed with even slightly different conditions, the outcome can be dramatically different. And which one is the true depiction? These issues are critical to all of medical photo documentation across the entire hospital system, including dermatology, cosmetic surgery, areas of aesthetic medicine, and wound care. TrueSee is a complete solution to create color-calibrated and consistent pictures using established movie industry standards. We offer both a standalone and integrated solution. Calibration simply means to bring something to a known standard. By placing the TrueSee patent-pending calibration slate in the photograph, the software can calibrate the image so you know it's accurate and you can trust it. So all those great pictures and all those great devices, they will render this calibration slate differently. But now you'll be able to see it. You'll be able to correct for it with our patent-pending software so it's accurate and can be relied upon, and anyone can look at the same picture and see the same thing. For example, even when this picture appears to be normal, it does not indicate the stage 1 ulcer that was present to the clinician. By calibrating the picture so the colors in the image match the known colors of the TrueSee calibration slate, the ulcer is now clearly represented. If this picture was on admission and the wound was not properly documented as pre-existing, this could have significant financial impact on the hospital.
Now I feel this is a true representation. You can look at it and feel like what you're seeing is what was really there.
I've trained in over 15 clinics, and it was very easy.
Simply remove the backing and adhere the TrueSee calibration slate near the wound. You can use almost any camera on the market. With our framing system guide, it is very easy to make sure that orientation and the frame of the picture are correct and consistent. When uploading pictures into your EHR, the clinician can now immediately see exactly where the previous person measured from, so they can follow the same protocol. And then they simply move the measurement anchors to electronically measure the wound. Once exported, a TrueSee image can always be recognized by the visible certification features and the invisible security watermarks. This is the sign of confidence. For hospital systems, the data displayed on the certificate can be customized to include patient or hospital information and even your logo.
It was a real aha moment when the first time that we ever tried it, and we're all together and somebody was moving the cursors and a conversation started. Everybody's like, oh, you measure it from there or you measure it from there?
Inconsistent measurements can lead directly to inconsistent billing. Measurement charts that look like these can now look like this.
Everyone measures differently, and I don't think that people realize that that can affect patient care. When we measured the old way, we actually had a wound vac pulled from a patient early because of inconsistent measurements. Now with Iris, we don't have that problem anymore.
It gives you consistency for billing. It's vitally important. And honestly, using Iris to measure is more efficient.
It's actually easier to use and saves time. I've seen a big change in validating patient care. We don't spend near as much time sending records, calling physicians, because once you send the notes to the insurance provider and they see that picture, it's usually approved quickly.
We've actually had to send in information to insurance companies to prove the service we provided, and being able to send our photos with the IRIS software so that they're color calibrated has been able to help us with those insurance claims to prove that what we actually sent them for a bill was accurate.
I definitely feel like it's raised our standard of wound care because of the consistency, the professionalism of the photographs. Our bottom line for the hospital is better because we're taking less time.
This is a standard in all of our clinics, and frankly, I feel like it should be the standard for everyone.
True C. Calibrate your vision.